and welcome all of you to the Speaker Spotlight series of Region 6. Thank you for joining today. I'm Darlene Caskey, the Community Engagement Coordinator for Region 6, and I help our network member organizations engage collaboratively with communities all across our region to support their health information needs. I'm going to also share a new slide. Bear with me. Hey, here we are. Thank you. So I had my greetings and welcoming you to the Speaker Spotlight series. And I also want to tell you that we're here to support people's role with NNLM. And one way we do that is through our sub-award program. This is an opportunity for our network members to apply for a competitive award. Each year, the awards vary in scope and prize, but what they always have in common is supporting the mission of the network of the National Library of Medicine. And that mission is to advance the progress of medicine and improve the public's health. Now, NNLM does this by supporting a highly trained workforce for biomedical and health information resources and data, and by improving public access, use, and understanding of health information. So joining us today are 3 of our 2021 award recipients. 2 of our 3 speakers applied for the Public Library Collaborative Award. And as the name suggests, these projects were in support of partnerships between public libraries and other community organizations. Michelle Anderson has been a library director at Atlantic Public Library since December of 2017. She holds a BA in education from Northwestern College, that's in Orange City, Iowa, and public library director certification from the State Library of Iowa. It's her goal to make the library a welcoming place for all community members and to serve their needs, not just follow library trends. Stacy Knight Davis is the public health and nursing librarian and head of circulation services at Eastern Illinois University. She holds an MS in Library and Information Science from the University of Illinois at Urbana-Champaign and an MS in Technology from Eastern Illinois University. She was a team member for the Southeastern Region Broadband Ready program, that's in Illinois, in 2021. Our third speaker is Tom Heisem. He's a consultant specializing in adult basic education with an emphasis on distance learning and digital literacy. He currently manages North Star Digital Literacy facilities of the St. Paul Community Literacy Consortium. He works as a consultant with the statewide Minnesota ABE Distance Learning Support Network and serves as grants manager for Literacy Action Network. He presents frequently at state and national conferences. Tom also has a master's in organization leadership from the University of St. Catherine. So what I'd like to do, I should mention that he and the organization Literacy Minnesota received our Digital Access Award of up to $20,000. So today, all 3 speakers will share their project and their experience with applying for the award. And then they look forward to answering any questions you might have. Please, throughout the presentation, be putting questions in the chat box. And at the very end of their presentation, we will do a Q&A and hopefully address any questions you have. So I'll start with Michelle, and I'll stop sharing. And Michelle can present to us about the Atlantic Public Library and its partnership with Healthy Cass County to provide mental health services.
Thanks. Just give me a moment here. Find my slides. They're not going to give me full-size slides. Here we go. All right, so thanks for this opportunity to share about our project. So just a little bit of background information. Our county led by an organization called Healthy Cass County, completed a community needs assessment in the spring of 2021 that identified mental health resources as the greatest need across all sectors of the community. So from citizen surveys to health provider surveys, everything was pointing to mental health was a need in our area. And as a librarian, public librarian, we see that need often just from the people who use our building. And then I had another thing. I was trying to find a way to fund tablets, to get tablets into my library. And so when I saw this opportunity for the Public Library Collaboration Grant, I approached Healthy Cass County about using their health needs assessment and building a grant application built around mental health resources that would include the ability to bring tablets into my library. So we did this. So we wrote a grant that did 3 separate things. So the first was bringing tablets to the Atlantic Public Library. The second was creating a resource of nonfiction books and other resources that would circulate throughout the county. And the third one was public programs. So the tablets, the bulk of our money, so we got just over $18,000, and $10,000 of that went to this tablet station with its kiosk. And we tied this into our mental health resources. As you can see on the screenshot from the tablet, the 3 of my library logos down at the bottom, the little light bulb with a book in the middle, those are all direct links to mental health resources. So like Medline Plus mental health, COVID Recovery Iowa, and I don't remember what the third one is off the top of my head, but this way, people who come in to use these tablets can do it in a more private way and find that good information and not feel like people are looking over their shoulders. So we were able to partner this Public Library Collaboration Grant with another grant to be able to bring this tablet system into the library. And I'm planning to do some more digital literacy coming up in March and beyond. Then the second area we worked on was to put resources in each of our Cass County libraries. So because Healthy Cass County serves more than just the citizens of Atlantic, we talked about how we were going to do this. And so this is where we got the idea for, let's put things in libraries. So we have this set of material for children, teens, adults, that is available in every library in Cass County. Atlantic is the largest library in our county. We have a population of just under 7,000 here, all the way down to a couple hundred. So each of our libraries has the same slate of resources. So for children, we have 8 books plus a yoga kit. For teens, we have 13 books and 2 card games. For adults, we purchased 14 books, 4 documentaries on DVD, 2 faith-based book kits, and I'll get to that a little bit later, and some meditation tone chimes, which you can see pictured there. So each library got their set of books. Let me tell you how fun it is to order for 6 in quantities of 6. Being a little library that I don't even do the ordering usually, but for the grant, I did the ordering. And so I ordered 6 copies of everything you see in this picture. So I asked each library to create a display and to have a display up for at least a month. So this was one of the library's displays. My library is a Carnegie library, so we had a downstairs youth display and an upstairs adult display. But then we also included with every checkout this little bookmark you see to the side that just says, did you find this helpful? Would you recommend it? And then the back of the bookmark just has empty lines that people can write anything else they want to write about the resource. And then we're collecting that, and that will be part of our review in my final end report. Another thing we did was all of our libraries use Biblionics Apollo as our ILS, and they allow us to create book lists. So if you can kind of see there circled, that's my catalog, and our book list there is mental health resources, and then it populates that list down at the bottom. And then the third section of our grant was public programming. And this is where I was really grateful that Darlene was so supportive of pivoting from original plans, because we had some things planned, and then other organizations got grants and they were able to fund programs we wanted to fund through other sources. So we changed up what we did a little bit, but we had 2 virtual programs, that Therapy FAQ and the Restart Designing a Healthy Post-Pandemic Life. And then we supported publicity for 3 in-person trainings, the QPR, which is suicide awareness training. And then the other pivot we did was we created 2 faith-based book groups. And one is currently in use at a local church, and one is in a book group that the library here is holding. And I'm just excited. We've gotten really good response on that. This is the first time I've ever reached out in this way, and we've got good attendance and good results so far. And we'll be able to have those kits available for other groups later on. So that's what we did with our $18,000-ish mental health resources grant.
Thank you, Michelle. It's really exciting, and you've been really fun to work with. So I meet with our awardees once a month, like a 15-minute check-in, primarily just so I can know if there's anything else I can help them with. And questions do come up regarding the NIH grant. So that's been a wonderful collaborative as well. So our next speaker also received the Public Library Collaboration Award. That's Stacy Knight. And she's going to talk about how Eastern Illinois University worked on digital health literacy and gender and sexually diverse populations.
Well, thank you for that introduction. I will give everyone fair warning. My computer camera is being temperamental today. So if I suddenly disappear off your screen, if someone could please say something so I know to unplug it and plug it back in. I'm hoping the little glitch I had earlier today is the last of that, but you never know. So I'm going to go ahead and share my screen here and get my slideshow started. If I can find the button, there we go. Okay. So the project that I'm speaking about today is an outgrowth of a different grant that we had last year here at Eastern Illinois University. And that was the Broadband Ready Illinois. And I was working with the Southeast Region team for that grant. And the idea there was that there is additional broadband capacity coming into the region. There are people that are going to have access that didn't before. We are a fairly high poverty region, so there are also some opportunities coming up, some of it through the COVID funding, through some other programs where people can get access that may not have had it before. So we were trying to, with the Broadband Ready project, we were doing train the trainer sessions where our digital literacy coordinator here from the university was working with public libraries throughout the region so that they could train their users, their patrons, their staff on good digital literacy skills. And we had a very good communication studies graduate student that was our coordinator for that. He also worked in a lot of information on privacy, on evaluating sources as to what the motivations behind them might be. His whole senior project was on propaganda. So he had very interesting ways that he would make people think critically about the material he was presenting. So that's kind of the background of where this came from, because when we hired on the coordinator for that project, he told us up front, he says, I don't know anything about health. I don't really want to do health. Please don't make me do health. So I said, that's fine. We can get separate funding for health, hopefully. And we did. So here's the team that's doing the health part of the digital literacy. There's me from here at the library, my colleague, Lori DeRitter-Willems, who's just across the sidewalk over in public health, and Beth Gill, who is the coordinator for our BS in health communication. These two professors have been absolutely wonderful. Lori, coming from public health, knows tons of things about social determinants of health, how to communicate things. Her current research area is young adults starting their own health care, figuring out how to move from being under your parents' care to dealing with your own care. So she's brought a lot of great perspectives into this. Beth, of course, in health communication, does a lot of interfamily communication about health issues, patient-physician communication. So she's been great with information on self-advocacy and how health communication works. So these two know all the stuff that there is to know about digital health literacy. I'm just kind of over here to help point them towards library stuff that they can wrap into what they normally do. None of the three of us have a lot of time on our hands. This is the kind of project, that all of us were excited about, but we don't have time for. And what we discovered on Broadband Illinois is if you ask for salaries, then you can get students to do a lot of this work, and you just point them at the problem and guide them, and they do wonderful work because they actually have time. So our coordinators for this project are Kim Ross, who currently works with our county health department. She's a master's candidate in the School of Public Health. And Carrie Winterdahl, who is a undergrad student in public health and works primarily with adults with developmental disabilities. So both of them coming in with great experience. Kim was a nature educator before she moved over into healthcare. So she's great doing education, teaching. We're really hoping she'll get behind the grant evaluation project because she did tons of that when she was working in nature education. A little bit more about Broadband Ready. The Center for Regional Development at Purdue did a very nice demographic study of our region. Here's our surrounding counties, and the areas in Aqua are the areas of high digital distress, which is where there's either not great access to data or not great access to devices or both. As you can see, we are a very high digital distress area. And a lot of that is just because the infrastructure was never put in. There's just, the cabling isn't here, the signal won't get down in the valleys, whatever. There's problems in getting signal out to people. And over here on the right, this is my all-time favorite picture from the Broadband Illinois project. This kind of encapsulates for me the entire broadband experience in central Illinois. This is where they're hanging the fiber optic cable in Charleston, Illinois, down 4th Street. I drove by this every day for weeks and finally just had to get out and take a picture of it. They had started spray painting fiber on it, decided that probably wasn't going to get the job done, spray painted that out, and then put not copper on it so no one would come and steal it for scrap money. So we have a very high poverty area where people are likely to steal cabling off the side of the road, and we didn't have cabling in place to run the internet at high speeds until these lines came in. So that is my favorite picture from the Broadband Illinois project. Here's the same map I just had earlier. The yellow dots are where our major partners on this project are located. The 2 dots in Coles County, that is Mattoon on the left and Charleston on the right. That's where the bulk of our partners are located. Charleston Carnegie Public Library, Charleston PFLAG, EIU Academy of Lifelong Learning, EIU Center for Gender and Sexual Diversity are all in Charleston. Then over in Mattoon, we have Lakeland College and Lakeland Pride. Also in Charleston, I forgot SACUS, our Sexual Assault Counseling and Information Service. They are not an official partner, but our PFLAG coordinator works for them, and SACUS is down the hall from the County Mental Health Board where Kim works. So it's a small enough region that everybody knows everybody else. So we've kind of brought SACUS into the fold because they're down the hall and we see them. So we also have the larger public libraries. We've got the Effingham County Public Library, or sorry, Effingham Public Library, which the director there is an EIU alum. And we've also got the Elizabeth Titus Library up in Sullivan. And we recently snagged one of their clerks as one of our night staff here now. So we are actively snagging the employees from Elizabeth Titus up in Sullivan. So there are other public libraries scattered throughout the region, but they are quite small and not heavily resourced. So they didn't have the staff to devote to this project. We do plan on sharing our products from this grant with them and with the Illinois Heartland Library System so that these things can get spread around. But as you'll see here in a minute, there just weren't enough staff to really pull this off with the in-person workshop format that we had established with Broadband Ready, which is what we wanted to do. Our initial parts of this, we did go out, we did some information gathering. There were in-person interviews with the public libraries and with our partner organizations. There were meetings with our coordinator that had worked with Broadband Ready to kind of talk about how that project had went. I should also mention that Tom, who's going to be speaking next, his North Star resources were used by the Broadband Ready project. So there's also a tie just amongst those of us here today. PFLAG did a big health summit. PFLAG is a gender and sexual diversity support group here in Charleston. They had one of our local providers came in and talked to the community. There was also an in-person meeting that we went to that was kind of trying to figure out how to work with the health system on some issues that have come up for our trans and LGBTQ populations. We and our grant group here attended the workshop on trauma-informed librarianship, and both of our coordinators have gone through all of the LGBTQ training that we could find on the NNLM site. So quite a bit of background work went into preparing to get our videos done. And actually, we weren't planning on videos. We were planning on in-person workshops where we could talk through these things and have nice interactive discussions. And then COVID hit. And you can see here in the graph in the middle of the screen, they actually ran out of scale and had to redo the whole graphic so they could fit January in there because January was a real bad month. And the public library in Charleston actually ran out of staff in January because so many people were out sick from COVID. So it was not a good time in January. And we decided at that point to pivot to just doing video instruction rather than doing live in-person workshops, especially because our partners at Lakeland had requested video because it's so hard for them to get all of their people together in one spot. They said it'd be easier if we could just hand out videos. We said, great, we'll pivot, we'll do the videos. On top of the COVID, February has been one of the worst weather months we have had in a long time. We've had 3 different times where classes had to be canceled because of weather. We've had ice storms. It's just been terrible with the weather. And in spite of how bad things were in January, our vaccination rates are still miserably low within the county. So we just gave up. We're doing videos and we're going to make that work. So we do have a small podcasting studio in the library. Here's a picture of some students using that. We're going to be recording the audio for our health literacy videos down in the podcasting studio. At this point in the project, the slides and the scripts are very close to being done. We are sending all of our slides for the LGBTQ videos out to a consultant who did her thesis on culturally informed care within a student health setting. So she's overviewing those now to make sure we got all the terminology correct and everything's on point. So we hope to start recording those very soon. And then I just have some quick snapshots for you from the slide presentations that we're doing. Kim has done some great work making really eye-catching graphics with these. We've got a couple that are just kind of general introductions to digital health literacy for our public librarians. This is one of those, the title slide. She's pulled in a lot of great information on how to recognize low digital literacy. She's also doing a lot of work to make sure that the librarians and the public libraries are aware of what they can do to help with both digital literacy in general, which a lot of them were exposed to already from the Broadband Illinois project, but also health information literacy in particular, and what they can do to help with that, and what other funding sources might be available to them once they start looking down those roads. Kim's also working on the LGBTQ community slides, and she's got, again, great graphics, great color going with these. She's done a lot of work in finding stats to kind of support why we do need to give this community extra attention to help with the disparities that they're facing due to how society is making healthcare harder. So our next steps, we're going to get our videos finished up. We're hoping to drop the links to the videos into Qualtrics, which is our big survey tool that the university licenses. That way we can make sure that everybody does the pre-test and the post-test, because the only way to see the video will be going through Qualtrics and going through the pre-test and the post-test. So we're hoping to get enough out of that to do our evaluation. The two coordinators, Kim and Carrie, are working on a website in LibGuides to go along with the videos. And then we'll do a lot of publishing and presenting. We have a proposal in right now for the IHA Health Literacy Conference to do a poster with them. So as we get further along in this, hopefully you'll see us in some more places talking about how well things went and how things are going good for us. So thank you all for watching my whirlwind tour of the project here.
Stacy, thank you so much. I got a lot out of this. I'm very impressed with your perseverance going and the pivoting. And the idea of doing the pre and post survey, that's a good idea to find out how people, what they learned from watching the videos. So looking forward to that. And also the publishing. That's wonderful that you'll be able to do a poster, a presentation of this work. So thank you for all that. Next, we have Tom. And Tom did not do a public collaboration, a public library collaboration award, but he did the Digital Access Award. And it was nice of Stacy to mention Tom's North Star project. And he's going to talk about how Literacy Minnesota is developing this digital literacy skill tool for telehealth.
Are you seeing my screen or not?
Tom, we do, but it's not in presentation mode.
Fine, thank you. All right, there we go.
Looks good, thank you.
Okay. So I'm going to talk a little bit about our new digital literacy assessment around telehealth appointments. It is a resource for North Star Digital Literacy, which I will briefly talk about, and then I'll talk a little bit about what we're doing and what our end product will look like. So for those of you who might not be familiar, I think having a little bit of background about North Star would be important. We're a program of Literacy Minnesota, which is a local nonprofit agency in Minnesota that also does a lot of work nationally around literacy advocacy, technology and distance learning training, digital navigation, et cetera. Our North Star is focused on serving people with limited digital literacy skills. When we first created it a number of years ago, we did a lot of study and realized that there were lots of programs that serve people with moderate level skills who wanted to go up to the next level, but nothing that we could find that served people with very low skills. So we currently, as of yesterday, we had over 2,400 locations in 9 countries and 50 US states. All of our resources are available for free on our public website in terms of all of our assessments. And for a small annual fee, organizations can access our curriculum and our online learning. We've had tremendous growth in the last year or so. We had 1,100 sites at the beginning of last year, and over 2,400. And a lot of that growth has been in terms of libraries. We have a number of states who have brought their entire library systems online, including Ohio, California, and Washington State, as well as quite a number of others. So North Star features online assessments, and I'll very briefly go over what those are. We have instructor-led curricula for all of our assessments, and those can be used either taught online or in person. We have self-directed online learning for 6 of our assessments and are building the rest of them out as fast as we can. And then we have a learner management system with a variety of reports that sites can access. And right now we have 14 assessments divided into the areas of essential computer skills, essential software skills, and using technology in daily life. So the telehealth module, we've for some time now, especially when the pandemic started, but even preceding that, we were really aware of the need for people who are increasingly having to access their healthcare online, search for healthcare information online, to have some information that would be specifically helpful for them. And we have a series of about 5 modules that we have assessments that we ultimately hope to be able to produce. But the first one we decided, which we applied to for funding, and we're granted that, which we so appreciate, that lack of access skills and devices have really, as we all know, widened those healthcare disparities. So we decided that telehealth would really be our first major focus. We applied for funding and received that. And we hope that this will help more marginalized communities obtain more equitable health access. So our process, and this is true for all of our various assessments, we first spend a fair amount of time developing standards, and there are usually about 15 or so standards for each of our assessments. And those summarize what things people need to know in this particular area. Then building on this, using the standards, we create a storyboard, which is the basis for our coding. We then create and record audio that will go with it. Our developer codes the storyboard to create the assessment. And that's where we are right now, where he's in the midst of coding as I speak. We'll be piloting the assessment later this month, and then we should be able to release it fully by the end of April. So this is a screenshot of the standards that we are using for telehealth, for the telehealth module. If any of you are interested in copies of that, I can send those to Darlene and she can share a link for them. But these are after a lot of study and interviewing a number of experts. We worked with Wisconsin Health Literacy, which is well known for their work in this area. And then consultants Maricel Santos and Amy Sheehan, who both do a lot of work with lower language level and lower skill level learners in the area of healthcare. So this is just an example of one of the shots from the storyboard. It will look a lot smoother when it's coded and so on. But we basically use PowerPoint when we do our storyboards and design it in there. And then our brilliant developer makes it look really, really very nice and so on. So all of our assessments or nearly all of them are context-based, scenario-based, because it's much easier for people to show their skills and to learn skills when there's a context for that. So this particular module traces somebody as he's arranging a telehealth appointment, if he's going through the telehealth appointment, what he needs to do with his device, and all the various things you need to know to make effective use of that. So I mentioned coding, because I skipped ahead. Our coding is done. We've already recorded the audio, and we're looking really forward to releasing this. We think it'll be very helpful. And hopefully our next project we're looking at will be health portals, because we know that's a real crucial need for people. Also, some of you might be interested to know that, although it's not particularly related to this module, that we're in the midst of 2 major efforts that we hope will make our resources more widely accessible. One is making everything totally mobile compatible. You can access the assessments on mobile, but they don't look exactly right. So we're doing a lot of adaptation there. And then a major project is changing the coding so that we can much more easily translate our resources in other languages. And we hope to have at least our first 3 basic computer skills, basic email, and basic internet skills ready in Spanish sometimes this summer. That's our goal, keeping our fingers crossed. It's quite a massive project. So Darlene also asked if I could talk about any pivots in the project. First of all, I think as we got into the standards, we realized anew how really complex this whole issue, this subject is. And it's not that we were unprepared for that, but it just sort of sank in that this is a very complicated thing. We did a lot of listening sessions with adult learners, because I originally come out of adult basic educations, and various experts, and they suggested that we should eventually try to have all of these 5 assessments done that I alluded to earlier. These were the things that individuals said they would most benefit from. And getting input from the adult learners and telehealth experts really added a great deal to the project. We're hoping in the future to expand the team to include medical experts that are directly serving patients to provide even broader input. I should also mention that when we pilot our assessments, we try to pilot them with a very diverse audience. People, that are marginalized in various ways, people low income, persons of color, a wide variety of different sorts of audiences, because we want to make sure that we're as relevant and culturally sensitive as we can be in the information that we present to people. So an added bonus, I think I told Darlene this, I'm not sure, but the Western New York Library Resources Council has just given us funds to develop a curriculum that will go along with this assessment later this year. So we're real excited to get started on that as well. So that ends my part of the presentation.
Thank you, Tom. Thank you. It's been a pleasure working with you on this. And it's wonderful to North Star has such a wide range, knowing that the money that we've been able to support your project with will have a wide range of an audience and impact. So now this is our Q&A session. So for those of you who've been listening, hopefully you were welcome to put some questions in the chat box as we went along. I don't know if there are any right now. I'll have to take a look, but now is a great time. You also can raise your hand, and then I should be able to allow you to unmute if you want to ask your question via your own voice. That would be great. So any questions from our panelists about their award, about their projects? Any questions from the audience? I'll start by asking a couple of questions. A couple of you have talked about the collaboration. How important is it? How important was it to you, the success of your project, to collaborate with other people or other organizations?
Well, I guess I could just mention that for us, it was very important in terms of working with Wisconsin Health Literacy, which has a lot of very specific knowledge in the area of digital health literacy at a deeper level than we had, at least to begin with. Hopefully we've learned a lot along the way. And then having Maricel and Amy help was also quite helpful, bringing their specific perspectives in online healthcare into the project. And they reviewed our script, our storyboard, the final project. And then, and I mentioned that we also worked, of course, with adult learners, and we'll be piloting with a number of different audiences later this month. So we want to make sure that we recognize and integrate a variety of perspectives, views, and needs into everything we produce. So that process is really very important to us.
For my project, it was really important to have Healthy Cass County because they had all the health ins and the the connections to local therapists. They had all of those ins, and then I could just function as the librarian, as the connecting the dots part. And so it really helped us forge a really good working relationship. And the coordinator for Healthy Cass County and myself have already said we're going to continue with our weekly check-ins, just because our weekly check-ins haven't consisted only of this grant. And we're learning more about each other's organizations and how we can support one another.
The experience with our project has been similar to what Michelle's describing. We wouldn't have a project here if it wasn't for the collaboration between everybody. And it's been helpful to make everyone aware of what all's going on in the different corners. The health communication major and public health department are now Region 6 members, which they weren't before we started this. They're much more aware of what's going on with NNLM stuff. I'm more aware of what's going on in their departments, and the public libraries now know about all of us, and the GSD groups now know that we're here and interested and want to try to help. So it really is just getting everyone talking to each other is the only way it works with the resources we've got.
Wonderful. Thank you. And we have a question from Derek, who is the Associate Director of Region 6. Tom, you mentioned this already, but do you work with healthcare providers or payers to make the assessments available? Just thinking with telehealth and then portals on deck.
Actually, yes, we do. It was not a setup question, but I'm glad you asked that. We have a meeting. We're going to be meeting fairly soon with MyChart, and they've talked about perhaps listing these resources. I guess there's a section of MyChart where they link to various healthcare resources, and hopefully they will decide to include us. We've also had some preliminary discussions with United Health about how they might use North Star. So we're always very open to that, and it's really our in terms of expanding our assessment and curriculum and online resources. Healthcare is really going to be our focus for the next at least year or two. So we are really trying to talk with as many health as we start developing products that people can use and access freely. We want to get those out to as broad an audience as we can.
Great. That's very cool. Thanks. We're glad you're on the cutting edge of this. Any other questions out there? This is your chance. Several of you touched on how you had to pivot. Did you find the process of pivoting, that's always challenging, but did you find being able to pivot was easy enough to do with this particular award or with our organization?
100%. In fact, Darlene and I, when we had our January check-in, and I'm like, Darlene, all of the other programs we had slated are now being funded in other ways. We just sat and brainstormed for a while until we landed on the starts of our new plan. And Darlene was very supportive of it. She said that still fits what your grant set out to do, and run with it.
And I would say we did not have to make as dramatic a pivot as you did, but as we made little tweaks along the way, it went very well. And Darlene was again very supportive in support of those things we did.
Yeah, we had already planned to do some video content, but the video was going to be more of the supporting show that went along with the in-person workshops. And then when we had to cut the in-person workshops, is just, okay, well, now we'll do more videos, no problem. So with everyone having lived through trying to move classes online in 2020 and then back and forth and everything for the next several semesters, I don't think you can phase the faculty anymore here. They've pretty much lived through everything at this point. So they were ready to go.
Now that you've been through this experience of applying for this award, and it's new to all of you, this particular award, I'm sure, any advice for people that might be hesitant to apply or nervous? It's an NIH grant. Any pointers, advice, encouragement? Anything you would do differently if you were to start over again?
No matter how early you thought you have started on technology ordering, starting 3 months before that apparently is where you need to be, because we thought we had started early enough, and then through multiple internal accounting mishaps, we still got started later on our ordering than we needed to. So however long you think internal accounting is going to take, add another couple months to that and make that ground zero.
I would just encourage people to apply. I think even before the application, Darlene had answered an email. I said, this is the project I'm considering. Would it fit better under this or that? And even at that point, she was like, that's definitely public library collaboration. Go for it. And even at that point, she said, you'll have to give us more details about your resources for circulation, and give us more details about your programming plans. And so she was very helpful. And I won't say she held my hand, but this is one of the larger grants I've ever written. And I'm not a professional grant writer. I have a staff of 7 in my library that serves a city of under 7,000, and I got it.
You can feel good about that, right?
Right.
It feels really good. Yeah. Good.
I would say the process for a federal grant was surprisingly easy. I'm used to some of these massive federal grants. We're partnering with a couple of universities on what's called an IES grant. And that process of applying, we did receive the grant, was incredibly complicated and so on. And I thought the application form for this grant was pretty clear, thorough, and straightforward and followed logically and easy to fill out. And and certainly working with Darlene and checking in with her has been a good and easy process. So I think I would tell people that the process is user friendly, I guess, in the jargon.
Good. Glad to hear that. So good. People shouldn't be intimidated. If they've never applied for an award, it's possible. And
the feedback is extremely helpful too. I think it came out being a much stronger proposal after going through the initial review, and then the request for clarifications came in, really helped us to figure out what we needed to be doing.
That's good. And that is a lot of the reason, I think, for the details. When we encourage you to think through the details or create the timeline, it's really for your benefit. You have a short window of time, 1 year, or you had 6 months, I should say. So those details really help formulate how this process will work. So you can hit the ground running and just be aware of the reality of things that you're going to face. So that's the reason for the details. So good. Well, any other questions? I don't know if we have any more coming in. So maybe I will talk about, let me share my screen. I'll talk about our next proposal period. We've started our new performance period for our NNLM. Begins on May 1st. And so we want people to have the opportunity to have a full year, 12 months, to work on, if they apply and they receive funding, we want you to have a full year to complete your work. So let me share my screen once more. Okay. So we've made the call for proposals. We initiated that call, I think it was about 3-4 weeks ago. And in this performance period, we have 3 awards that we are offering. One is the Health Information Outreach Award. It's up to $20,000. And this award will help you think about improving health literacy and increase health equity through engagement and training for health information. We also have a Research and Data Outreach Award. This is to support projects that innovate biomedical data management or support research data services within academic and healthcare institutions, or help train the workforce for accessing, understanding, and using data for biomedical and public health information research and education. This award is up to $15,000. And then we have a third award called the Student Development Award. This is to fund an NNLM member organization, whether it's a health sciences library or a public library, to support a short-term library and information intern interested in biomedical information and data or consumer health information reference and instruction. And this award is up to $10,000. And the application, the deadline to apply is March 11th, so that is 10 days from now. So hopefully many of you may have started your proposal, your application, or if you haven't, you still have some time. And you're welcome to contact me if you have any questions about any questions about the process. But to learn more about these awards, please visit nnlm.gov/region 6. To tell you a little bit more about these awards and some of our what NNLM is looking for, we do have some priority health topics in mind. And if your proposal or application touches upon these areas, they probably would get a higher consideration, but not to say that your award has to focus on these 3 health topics. But 3 health topics that we are looking at are health misinformation. The U.S. Office of the U.S. Surgeon General has, in late 2020, announced that this is a public health issue, health misinformation. There's also the digital divide and equity associated with people having broadband access, as Stacy had mentioned in her presentation. And then there's the environmental determinants of health. That's really important as well. We think about the water crisis in Flint, Michigan as an example. So these 3 areas are of high concern to NNLM. Another priority area for NNLM is looking at the populations. Our priority areas are the medically underserved areas and populations, or populations underrepresented in biomedical research. And what are those MUAs and UBRs? They're usually communities determined to be experiencing health disparities as a result of their race and ethnicity, biological sex, gender identity or expression, or sexual orientation, cognitive and physical abilities, religious background or identification, socioeconomic status, their education level, geographic location, or other factors or demographics that create an unequal access to the highest level of health. And also, when you're thinking about writing your grant, we have resources to help you. When you write your proposal, you'll be telling us about the evidence of need in your community. We have a resource that aggregates the US Census data, the county health rankings, the medically underserved areas from HRSA, putting it all together in one place for you to easily access that information and communicate that evidence of need in your application. You'll also want to talk about your objectives and goals and provide a timeline. We have resources that can help you with that. We have exemplary requests for proposal application sections, things that were written that received funding. So you have an example to follow. We provide a logic model worksheet that you can work through. Evaluation is very important. Tell us how you will evaluate the success of your program. Our National Evaluation Center has material on how to design your evaluation. And of course, your budget. And we have templates that you can use also to describe what items that you will need subsidized for your program. So we thank you for joining us today. We hope that you've been inspired to apply for an award this year, or maybe you'll be thinking about this for next year. But we thank you for joining us. I hope this has been beneficial. You will receive a follow-up email with a link to this recording, a survey if you wanted MLACE credit, and maybe some handouts from today's presentation. But if you have any other questions, please reach out to me, contact me, and we will follow up accordingly. Thank you, everybody. And that concludes our program.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.